in week 12. So be here for week 12, okay? All right. So I have a PowerPoint. I will share my screen and we can go through this PowerPoint. Again, stop, ask questions, whatever, you feel you need me to clarify or answer, please just, let me know. So this by now, let's see if I can make this a little bigger for my old eyes. So what does public health do? So by now, right, we should all know what the public health and the community health nurse does, right? So the primary goal of public health is the prevention of disease and disability. It's achieved by ensuring that conditions exist in which people can remain healthy, right? So promotes independence with the nurse, autonomy, is population focused. We look to understand the problems and solutions within a defined population. The clinical practice focuses on treatment of individuals. The public health policies create health standards to decrease mortality related to communicable diseases. The leading cause of mortality is shifted to chronic disease, such as heart disease and cancers. We know about health disparities, right? Tell me, what are some of our health disparities?
Finances,
Okay.
homelessness,
Homelessness,
Access.
poverty rate.
culture.
Mm-hmm.
Education.
Mm-hmm.
Okay. Lack of access to healthcare, right? Health insurance. And so, yes, the health disparities, the largest impact is economics, right? We do have a much higher like it said, its focus has been more to, right, those chronic diseases. Oh, made it so big now I can't even advance my screens. Healthy People 2030. I know you've heard this before numerous times throughout the last 10 weeks, right? So Healthy People 2030, that is an effort to improve America's health. And so at first the goals were basic. They were focused on increasing years of life, right? Reducing health disparities, improving access to preventable health services. And so, we've kind of, you can see some of the changes that have occurred since the inception of Healthy People. So some of the Healthy People, 30 goals, continue to, look through those. Evidence-based practice, another should not be a foreign concept, right? It's the use of current best evidence in making decisions about the care of individual clients. And so, clinical trials that are randomized have seemed to be at the height of the evidence-based practice, showing this, the strongest strength. And so there are a bunch of different types of studies that we can do. Anybody remember pharmacology class? A little bit. I know I know back in pharmacology, you talked about some of the study techniques and stuff in there, as well. Maybe if I go back to the normal size, it'll just let me advance. Nope, there we go. So this is just some deep breathing, some strategies for success. All right, tell me about patient rights.
There's 9 of them.
Okay.
Patients have the right to refuse care.
Mm-hmm. So when we look community-wise, the primary focus is care of ill individuals and family across their lifespan, correct? Right, and so we look at the, they, the rights of our patients to receive safe, quality, effective healthcare, right? Across the continuum of life. So from birth to death, everybody has the same right to healthcare. And that's where all of our, disparities come into play. Why, certain people don't have access to effective or efficient healthcare. They don't have the economic means to provide care. And so what are some, so when we talk about patients' rights, and what are some of the ethical practice, can't even say the word, the ethical principles. Do you remember the ethical principles?
Are you talking about like I can't even say the word. And
Yes.
yeah, the other,
Beneficence and autonomy and okay.
yes, thanks, Ebony.
Yeah.
Fidelity.
Mhm. So maleficence and or beneficence and non-maleficence are usually the two words that you have to say in your head and then try to say them out loud, right? Because they're like tongue twisters, right? So tell me about justice. What is justice?
Fairness.
Fairness, right? It's providing the same to everybody regardless, right? What is non-maleficence?
No harm.
No
Do
harm.
no harm. Okay. So always kind of keep those, those ethical principles in the back of your mind. Because no matter where you work in nursing, whether it's in the community, whether it's med surg, peds, OB, mental health, whatever you decide where you want to work in nursing, those are all going to be, central to your practice. Quality and equity. All right, ethical decision-making theories. These words should be a little bit fresh in your mind since these were within the last couple weeks. Your utilitarianism, right? The greatest good for many. The end justifies the means. Your deontology, your right or wrong of an action versus right or wrong of the consequence. You're feminist, right? It's a more broad view. When we look, even if you look traditionally, even when we go back to the research, it was predominantly male based. Okay. So when even, and I use pharmacology as a, because I know that that's a really good chapter on all of that stuff. Even when we look at pharmacology, when they initially started doing drug trials on humans, it was always men, 18 to 22, average height, average weight, usually Caucasian, and that was their study specimen. All right, it didn't account for women. It didn't account of people from different races, ethnicities, that kind of thing. And so, feminines, obviously, when we look at the feminist ethics, how does some of this affect women? Even how do go back to how do certain medications affect different races, right? So there's a lot of different things. And so, trying to bring it all together to make it more, cohesive. And so that everyone is represented when we're looking at this. When we look at community, tell me about community. So you guys, when, we're looking at the first thing that we look, what's in a community? Just what are the parts of the community?
The people that live there, where they live and their function.
Okay, so the people, right, the places, the function within the community. When we look at, the different dimensions, the dimension of place or the dimension of people, right? We're looking at the census data. So you can go to the US Census Bureau and you can look at the census data for any given community within the United States. We can look at the Tourist Bureau. We can look at civics groups, we can look at churches. A lot of them keep information. When we look at the, libraries, police station, welfare agencies, state departments, those are data sources for the functions dimension. The dimension of place is measured with data sources of maps. And so we did some great community assessments. So, look at your windshield assessment, right? Driving through the community, looking around, see what is going on within your community. We're looking at the politics, we're looking at the economics, the education, the recreation, the religion. What's the population of that area when we are doing that assessment? And what does that help us determine? So looking at the community, doing your windshield surveys, looking around and seeing what's going on, what is that helping us to do?
Like
Yes, identify
identify
the
their
problem.
needs.
Yeah,
Say it again.
I said identify an issue, identify what the problem is.
Right. So you're identifying issues that are within the community, right? And that by identifying issues within the community, you can also identify resources and needs for the community as well. What do we do? A lot of it, homeless population, your underserved population, that group in the middle that don't have access to health insurance, right? How are we serving that population? Um, Community partnerships. So we talked about community partnerships like 2 weeks ago, maybe. I know it was on your last exam. So we have both active and passive, right? So if you remember from exam 3, active includes focus with community leaders, the businessmen, organizations, kind of to help with the healthcare providers. So, a good example was a program in a school with low-fat snacks being offered, right? So maybe there's a local business that's going to partner with the school system, right, to offer snacks for after-school programs at a reduced rate, right? What does that do? It helps to keep those prices low. It shows an active participation within the community. Anybody use after-school programs? Does anybody ever put their child in an after-school program? So after-school programs generally are much less expensive than daycares, right? So when you look at having to put your child in daycare versus using an after-school program, it's generally less expensive. And so if we can partner with the community and keep costs low in those programs, right, then that helps keep the costs low for the consumers, which are the parents that are using those services for their children. What would be an example of a passive community partnership?
Like a clinic, recreation center opening up in the community.
Okay.
Like the city creating a new park.
Right. Very good. Yes. And so think of those kinds of things when, when we're looking at, I don't know why I'm like some of y'all I can hear really well and then others it's like really quiet. Um, I'm just trying. I was pulling up the exam review too, so we can kind of like go through that as well. All right, so case management. You guys remember what case management is? Tell me about case management. What is the purpose of a case manager?
It's tailored to the specific client and you're gonna find like resources that are appropriate for them.
Right. So case management is specific to the client, to what the client needs. They, are advocates for the child or the family. They need to have really good advocacy and negotiation skills. They follow the nursing process just like they would in any other aspect of nursing. They also, exchange information, they gather data, they work to as like an intermediary between providers, therapists, dietitians, right? So they're like a coordinator of care to, try to provide for, get the best outcomes for their clientele. What else? Trying to think. Advocate. Case managers, it is a very intense position. If anybody knew, I don't know if anybody knows any case managers, but they have a lot on their plate. They're the ones that are going to work with like the discharge planners within the hospitals to make sure that when people are discharged, oh, sorry, I was reading comments too. This is what I get. Sorry. Um, but they I forgot what I was saying. Oh, so like if, they need to go home with a hospital bed or oxygen or, elevated toilet seat, a shower chair, right? They're kind of the ones that are going to be, they're the ones that are going to make sure that when the patient gets home, that they have those things or shortly after, right? Because you don't want to send somebody home that needs oxygen and the oxygen's not there for them, right? Or shortly after they arrive home. Um, and so they also, look at resource allocation, making sure that all of that good stuff is available. We look at quality improvement. Quality improvement, um, the first thing that we do with quality improvement is kind of figure out what everybody's job is going to be. Then we're going to evaluate the quality of care. Who works in healthcare now? I know there's a few, right, that work in healthcare now. And if you worked in healthcare or you know that you work in healthcare now and there's been a huge shift in healthcare. It used to be quantity of care, now it's quality of care, right? So you could live in that patient's room for 12 hours and do everything for that patient. But if they're not happy at the end of the day, right? It doesn't make a difference. And so, this is where your customer service skills really come into play. How to work with clients. Um, some clients are easier to work with than other clients are, right? And everybody is going to have, that one client that's going to give them a run for their money. But just your good customer service skills help. And then, we look at what are quality indicators. And then if, when we look at the quality indicators, if we are low in certain areas, we can evaluate, go back, do education, right? That kind of thing, as a way to increase those quality indicators. A lot of it's just meeting the needs of the patients where they're at. let's see. School nursing. Oh, wow. School nursing. What week was that? 1, 2, 3, somewhere in the beginning. So tell me what we learned about school nursing. Tell me
Is
what we remember
conjunctivitis,
about school nursing.
is conjunctivitis pretty common?
Say that again.
Conjunctivitis is common.
Conjunctivitis is common. Absolutely.
Yeah.
Gotta love pink eye, right? So school nurses have a huge impact on, our in kids and their and with kids. Um and so, they also may even provide some case management services. They may provide some community outreach, right? Helping families to find resources that are in the community. I know when I worked in peds, I had school nurses that, were always calling, whether it was for advice, whether it was to look for resources for kids. They're counselors, they're educators, they're direct caregivers. So there's a lot of things at school. They do care plans for kids within the school as well, especially for those that have chronic conditions. Um, you know, um, ADHD kids, they may have to, get their medications. But stomach aches, pink eye, headaches, those are all pretty common within the schools. Um, so you may, although most of the time with pink eye, you probably wouldn't see them in school. What are some levels of prevention that we would see within a school nurse's position? What's some primary? So I told you kind of what a school nurse does. What are some primary prevention that we would perform as a school nurse?
Education on hand washing, hand hygiene.
Hand hygiene, yes.
Exactly.
Even toothbrushing, right? Okay.
Right, immunization.
Immunizations. Yep. So they do the review of the immunizations. Yep. What else?
Education on like lifetime healthy eating habits, exercise habits, things like that.
Absolutely. Absolutely. Yep. Even things like substance use prevention, right? So all that education. What are some secondary prevention?
Don't they do the eye tests and the hearing tests?
Mm-hmm. Mm-hmm. Yep.
Scoliosis screenings.
Scoliosis screenings. Mm-hmm. My dog is sitting behind me making noises at me. What about, just dealing with like the headaches and the stomach aches, right? Even anxiety. Think of, those school nurses that are in like the preschools, right? They may have to deal with some kids, some children that have separation anxiety from their parents. They also may have to provide for, what if there's a medical emergency? Um, they may have to do CPR, they may have to provide first aid. What if kid gets bit by a bee, right? And they have an anaphylactic reaction. Um, then you're right. Then your screenings for your height, your weight, your vision, your hearing, your scoliosis. Do they do that anymore in schools, the scoliosis screening? They do. Um, lice, right? Even checking for head lice. And then, assessing kids for abuse, neglect, assessing them for, mental illness, a suicide, um, that kind of thing as well. Violence, um, and then tertiary prevention. What are some tertiary prevention that school nurses would do? And I'm sorry, I didn't mean to make you guys think so hard tonight.
Helping kiddos with diabetes or other chronic conditions do their
Oh.
insulin or whatever else they need.
Okay, yeah. So, whether, they have diabetes, whether they have asthma, I'm trying to think of what else you might see. You know, any other of the childhood diseases, right? A lot of these kids are mainstreamed now, right? So they may have to administer medications that were prescribed by their doctor. And so they have to be able to store the medication in a safe spot so that, other people can get hold of it. They also may have to do tube feedings, catheterizations, trying to think of what else, dressing changes. What else? I can't think of anything else. Of course, that's my brain. Oh, trachs. Kids go to school now with trachs and everything else. So they may have to provide some sort of trach care. They'll work with the other members of the school or, like teachers and other members of administration and setting up the individualized education plans for kids as well. And then, what if we're in high school and we're looking and we're, have, our pregnant teenagers, we can provide some parenting education for that population. And of course, we could even, provide education about preventing future pregnancies from occurring. So that's your school nurse. I kind of went through this. Teen health. So we talked a little bit about, we talked about pregnancies, mental disorders, substance abuse, smoking, nicotine use, nutrition, STIs, homelessness, academic problems, homicide, suicides, motor vehicle collisions. And these are all things that, if you work in a high school with older kids, these are some of the issues that you may come across with them. I will say that statistically, smoking has declined in our adolescent population, but it has been replaced with vaping. So we still don't want them to do that as well, just because of the, amount of chemicals that are in the vaping. It's not any safer. In fact, we really don't know the full extent of the dangers of it, right? Because it's still fairly new. All right, addiction. Addiction. So what do we know about addiction? What are some issues with our substance use disorders?
Not seeking medical care.
Okay, seeking medical care. So what does my addict look like?
What do an addict look like?
So not like a physiologically, what would we see?
Maybe like
Oh, okay.
sweating,
Say that again.
like sweating,
Okay.
like pale.
I mean, if we're talking like stereotyping, I would say like really thin, maybe sores all over, dirty,
Poor
unkept.
hygiene.
So in some cases, it depends on the substance that they're abusing, correct?
Yeah.
right? Some
Yes.
people are able to hide their addiction better than others, right? And so, when we're depending on the substance that we're looking at, whether it's, something like caffeine or tobacco versus your alcohol, your meth, your crack, what else? Heroin, right? All of that other stuff that is out there. So vital signs are going to depend on what substances is being used, whether it's a stimulant versus a depressant, right? So if I'm using a stimulant, what are my vital signs going to be? Are they going to be elevated or
Increase.
decreased?
Yes.
Okay. What about a depressant like alcohol, marijuana?
Decrease.
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 Okay. And so, yes, depending on what their drug of choice is, they may appear unkempt, disheveled, right? Um, Depending on the drug, their pupils may either be fully dilated or they can be pinpoint. Um, you may see needle track marks, things like that on your patients that are addicts, depending on what their drug of choice is. They also may have some tremors. So let's focus on what are some of the prevention. So what are some primary prevention strategies that we could use to reduce substance use disorders?
Education and therapy.
Education, 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 right?
Yeah.
Whether it's public, whether it's in the school system, right? It's a matter of increasing public awareness, especially among our young people, about the hazards, the risk of dependence, that kind of thing. We also, increase the parental involvement, right? Have you guys heard of like Mothers Against Drunk Driving? There's other, awareness groups that adults can also be involved in to try to help to prevent this in, teens. What are some secondary prevention strategies? So primary was mostly education, right?
Drug screenings.
Second, thank you. Yep. So it'd be screening for substance use disorders, also looking at identifying those that are at risk and helping them to reduce the stress. So what are some of the risk factors for substance abuse?
Mental health disorders or like a history of physical abuse.
Okay, history of abuse, mental health disorders,
Drug abuse in the home.
right? Some it's stress, right? They turn to alcohol or drugs in order to, try to deal with the stressors.
Family history too.
Say that again.
A family history of drugs that can.
Right, if that's what
Okay.
you grow up in, right? That's all
Yeah.
you know.
Economic stressors.
Mm-hmm.
Yeah.
Right. So if we can, find ways to help them reduce those stressors, maybe, we can offset that somehow. And what are some tertiary strategies?
Methadone clinic, MAT, giving them clean needles.
Okay. Alcoholics Anonymous, Narcotics Anonymous, what else? And then making sure that they have the support that they need, right? Whether it's family support, through their church, their community, right? And keep pushing that positive reinforcement, right? Because we all want positive reinforcement, right? We're all about, what I did well. And so that may help as well. Um, So there we go. Look, see, you did it and you didn't even have the slide yet. All right, STIs. All those fun things. So what are STIs?
Sexually transmitted diseases.
Yep, sexually transmitted infections. So what are some of the goals to, reduce the number of sexually transmitted infections?
Safer sex.
Yes. Abstinence is best, right? Abstinence is best. Education, right? Lots of education. Um, you know, even I don't know if they still do this anymore. This is me getting old. Free condoms, right? But it's not even just about, and I was thinking about this and I was reading something. It's great. What if they don't know how to put the condom on? No, silence, right? So we can provide it and then maybe even,
Demonstrate an
show them,
example.
right? How to properly use the condom as well. I was thinking about that. I was like, yeah, I'm like, these free condoms and all of that stuff are great, right? Because we're looking to cut down on the spread of sexually transmitted infections. But then I was like, what do we do if they don't know how to use it? That's my big thing. So what are some primary prevention? Education, right? Talked about education is key. Family planning, your sex education, what else? And then of course, disease surveillance, screenings, would be your secondary prevention, and then tertiary, right? Trying to prevent them from getting another one would be key as well in that situation. All right. Oh. All right, tuberculosis. What week was tuberculosis? I don't even remember. Tell me about tuberculosis. What is tuberculosis? How about we'll start there?
It's a bacterial infection that lives in your lungs.
It does what?
It lives in your lungs.
Okay, it can live in our lungs, absolutely. How is it transmitted?
It's transmitted through droplets, through coughing.
Okay. Um, so patients with tuberculosis gets into our lungs. It's usually cased off, right? So our body can or our lungs, the macrophages in our lungs can try to wall off the acid fast bacilli once it enters into our lungs. If it breaks free, it can go anywhere in the body. So that is your what we call extrapulmonary tuberculosis. So what is our primary prevention for tuberculosis?
Me educating about tuberculosis
Okay.
and the prevention of it.
What about your TB test?
No, that would,
I thought that would be secondary, the screening for it.
So with tuberculosis, I'm thought that I will have to look it up because now I thought that the TB test was primary, but I can.
Yeah, that's test and screening. So I thought that would probably be secondary.
Hmm.
Let's see. Yes, so primary prevention is screening, treating, and isolating patients that have tuberculosis. So we try to prevent, right? To try to prevent the spread. There's no vaccine there is a vaccine for there is a vaccine for tuberculosis that we do not use here in the United States. And so so part of the primary prevention is going to be screening. And what is the process for screening somebody with tuberculosis?
Asking them about their vaccinations, if they've received.
Okay,
If they've ever
so
had a
Having a
positive,
TB test, the
PPD,
transdermal,
there you
yeah,
go.
TB. Mhm.
Yep. So we do the PPD. What happens if my PPD is positive? What's my next step?
A
chest X-ray.
A chest X-ray. All right. What is how do we make a definitive diagnosis of tuberculosis? Anybody know?
Isn't it a sputum test?
A sputum sample. Yes. Now, um, if we can't get a good sputum sample, we can use gastric washings as well. But sputum sample is the gold standard for diagnosis. Um, It takes up to 21 days for us to get a sputum sample back. So, like if you go and the patient has a urinary tract infection or strep throat, we send that culture for we send a culture for culture and sensitivity, right? It takes 48 to 72 hours to get that back, right? And we get a nice list of what the bacteria is and um, what antibiotics will be effective against that, because tuberculosis is such a it's a slow growing bacteria that it can take 21 days for a culture. But we, generally by then, we'll be treating them with antibiotics. What is VAERS, Vaccine Adverse Event Reporting System? Have you guys heard of this before?
Like it helps detect unusual and unexpected reporting patterns of the adverse events of vaccines.
Yes. So anybody that goes for an immunization, anytime you're going to get a shot, you'll get a vaccine information sheet. Have you guys seen those, the VIS sheets? It basically tells you this is the immunization that you're getting. This is what it is. These are, what the ingredients are. It's also going to tell you um, what to do, what you should, what would be a normal expectation, and then when to seek healthcare. So your VAR or VAERS, right? That's any kind of abnormal reaction. So some people that developed like Guillain-Barré syndrome after receiving certain immunizations, they were reported to them. They are just a reporting system, right? They don't determine anything. They can't say, oh yeah, definitely the vaccine caused it, to happen. They are strictly there to collect data. And then, if they start to, recognize that there's a pattern of events, then other areas will do follow-up studies for that.
Really strange. And I like sat back.
Medicare versus Medicaid. Your Medicare is for those over 65. Medicaid is more of your low income, and disabled. right? And then, of course, we have private and public insurance providers as well. Homelessness. So what are some of the risks involved with our homeless population?
Infection, like due to poor personal care.
Okay, absolutely.
Substance abuse.
Lack of
Substance abuse,
nutrition.
okay.
A lot of undiagnosed diseases from lack of healthcare.
Okay. Undiagnosed diseases as well as living with chronic diseases that they're
Yes.
not currently getting treatment for, right? Because they don't
Mhm.
have access to health care. Okay, what are some of the common health issues?
Diabetes.
Hypertension, obese.
Yeah, your HIV, your AIDS, trauma, right? And even thinking about some of the weather related issues, right? Sunburn, heat stroke, heat exhaustion, frostbite,
Hypothermia.
malnutrition. I'm trying to think of what else. Um, we talked about mental health. What about our teeth, right?
Yeah.
Cavity, that kind of thing. Um, and so, what are some things that, um, we can do? Of course, the goal is to try to prevent anybody from becoming homeless, right? And so, if it's if they have, a mental illness, right, we want to kind of get them into therapy to try to prevent them from becoming homeless. We also, what are some things, that we can do in the community that would help to prevent homeless, like is there affordable housing, is there government subsidized housing, is there housing assistance that we can use, you know are there shelters? Are there other places where people can go? Our homeless population, unfortunately, here in the United States is growing, right? And it's not just single parents or it's not just single people, right? It's families that are becoming homeless now. It's our elderly population, right? It's all over. And so, trying to, advocate, within our societies, within our communities, for more resources, to assist, this population. Unfortunately, there isn't a lot of resources. There are a lot of resources, I should say. There are a lot of resources, but the resources are overwhelmed, right? Because there are so many that need them. What are some of our other vulnerable populations other than our homeless population?
The elderly and children.
Elderly and children, yes. What about
Refugees.
say that again?
The refugee.
Our refugees, yeah.
Mhm.
What about some of our rural residents that,
Mhm.
live out in those rural areas? These are all, issues that we have to worry about. What are some issues with migrant workers?
Mm.
They could be forced to work long hours or be like trafficked, things like that.
Right, long hours, more manual labor, right? So it's more strenuous. Um, what about exposure with our rural workers or migrant workers? Sorry.
Like
You're-
pests and even sun and like element exposure.
Very good. Yeah, like your pesticide exposures, your, being out in the sun, some of the issues, right? Food insecurity, what do you call it? Oh my gosh, the word inconsistent income, right? They might work, like maybe they work, long hours during the summer, but maybe they don't have a lot of work during the winter time. A lot of times they have, unsanitary living conditions. They don't have the ability to afford health care. There are also maybe some language barriers, some cultural discrimination that is occurring. And then we have to also look at their immigration status, right? They feel like they go to get health care. They may be deported, right? Stop it. My dog wants to talk to y'all too. I apologize. She wants to make herself known. And so, and then even those that are in the rural areas, right? They tend to have higher infant and maternal morbidity rates, higher rates of diabetes, of obesity, less likely to meet their physical education or physical activity. They have higher rates of suicide, increased trauma and injuries, right? From the farm equipment, even being, out and, exposed to the weather, less likely to receive preventative care. They are at risk for stress-related health problems, poor mental health as well. What else? Talked a little bit about pregnant teens, but the biggest thing that we want with our pregnant teens, right, is for them to continue their education, making sure that we get the best resources, that they're receiving their prenatal care, that they're receiving parenting education on how to care for their child, um, as well as, refer to resources that are in the community. And there's, things like your Women, Infants, and Children's program, their SNAP programs. And then of course with, what is it? Is it CHIP? I always forget the acronym, which is is it CHIP? Which is the insurance for kids. I want to say it's CHIP. It's like Medicaid for kids. I could have the acronym wrong. But all pregnant teens are considered high risk because of, the limited self-care, poor nutrition, limited finances. But the goal, like I said, it is to keep them in school so they can get their education. Then we have our occupational health nurse. So occupational health is a specialty within nursing. That's, occupational health does a lot. But a lot of us, if you worked in a, what do you call it, in a hospital system or a large medical system, you've probably worked with occupational health at some point, because they're the ones that will do your like pre-employment screening. They'll give you, if you need your hepatitis B or you need your tuberculosis or your PPD, they're the ones that help you with that. But the responsibility is for the health and safety of the employee. And so occupational health nurses don't just work in health, like in a healthcare environment. So they also, like in Virginia, like the shipyards, they have occupational health nurses. There's like some of your, what are they? I hate to use the word slaughterhouse, but I can't think of another name for it. Like, where you get your chickens and your turkey and your pigs and I don't know if they, I guess that's only a term, but they also have occupational health nurse, like Smithfield Farms is big in Virginia. They have occupational health. And it cares for the workers. They're supposed to, go out and make sure that, all of the, equipment is working correctly, that the employees are using the equipment, that they're minimizing their risk. So some of your primary prevention would be mitigate risk by wearing appropriate gear with the proper equipment, as well as education. Secondary would be screening for disease or detecting at the early stage, and then tertiary is rehabilitation, and restoration. So again, a lot of what they do surveillance, they keep track of injuries and risks that are occurring within that specific area. OSHA is a federal, it's your occupational safety and health administration that provides for your safe and healthy working conditions. It is what enforces the occupational health standards. It also maintains a database of work-related injuries, illnesses, and deaths. And it does help, or the occupational health nurse does help to enforce OSHA standards and regulations. All right, so it is 10:40. Let's